Okay, so if your four-legged furry family member's been coughing and sneezing, what do you do? I mean, do you worry about it, or is it something you can actually wait on? Well, we have, of course, our Sac & Co friend and veterinarian Lisa Hess. She has Laz with her as well. We love Laz. He's a sweet little Boston right there. I think he's going to fall asleep.
Yeah, he's
okay.
fine.
So dogs coughing and sneezing, it happens.
Yes, it does. And, the occasional cough, sneeze, generally not a big deal. Dogs and cats generally do not show the same hay fever, allergy type symptoms that we do. The cough and sneeze, occasional cough and sneeze might be caused by allergies. For example, like this Boston here has reverse sneezing, which often can be from allergies. It's inflammation in kind of the back of the mouth. And it's called a reverse sneeze. And some people are really worried. They think their dog's in respiratory distress, but it's really just a reverse sneeze, and it calms down.
It does it sound a little bit disturbing?
Sounds like an inward sneeze, and sometimes they stop breathing for a second. I can't really demonstrate it.
I know, because you're not a dog. So makes sense.
Yeah.
But I imagine the sound may be like a little kind of off, and you're like, oh my gosh, are they okay?
Yeah, and it can be rhythmic, and they can do it several times, and then they'll stop. And occasionally, I've seen many Bostons do it.
I was going to say, I've heard, I think my Boston do that. And I imagine, too, the compromised respiratory kind of makes it a little more
Yeah, and some
dramatic.
people really are, oh, no, what's going on? And it's, you can YouTube reverse sneeze, and you can see a ton of them.
That's a great idea.
Yeah.
Okay, really good idea.
So reverse sneezing, generally not a big deal, sometimes related to allergies.
Okay. When should we take a look at these symptoms in our pet and go, oh, this might need to be a vet call?
So if they're acting sick, if they're not wanting to eat, or it seems like they're having a hard time breathing, they're struggling to breathe with every breath, those are life-threatening emergencies that should be addressed.
Okay.
If they're having nasal discharge from their nose, green discharge, followed by lots of coughing, those things need to be addressed. So if your pet is acting sick, that's important, and I would make a trip to the vet.
Okay. What are the symptoms of kennel cough?
Kennel cough is really a loud cough, and it's you can touch them on the sort of neck region and kind of easily initiate this loud, almost honking, goose honking type cough. And kennel cough is an infection that many dogs can get from going to the dog park, being boarded at a kennel or a dog show. It's usually self-limiting, resolves in a couple days, but it's very infectious to other dogs. You could carry it in your shoes.
Okay.
Yeah.
And especially if you have a younger puppy then who has not been inoculated yet, then that's something you probably need to be careful of.
Even with the vaccine, they still sometimes will get a different strain of it and still show signs of kennel cough.
Okay. So just kind of be aware of that.
Just be aware of that. And then keep your pet separate from any other dog. And it's not transmitted to cats, it's dog to dog.
Okay, got it. What about if your dog is constantly sneezing and you suspect that maybe there's like a foreign object? I imagine this time of year
this
that's probably
time of
pretty
year,
common.
that's what we're seeing. Foxtail, 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 or even grass. And it's a real violent sneeze. So hachoo, and their nose kind of curls up where even blood can go down on the floor. If that's
Which I imagine would look alarming.
Yes, go to the vet right away, because the sooner the better. Because if you wait and that foxtail migrates up further, it's more difficult for us to get in to see.
Yeah.
So, but foxtails, I've seen pieces of grass, even constant sort of gagging or hard swallowing if they've been eating grass. Sometimes we'll sedate, we'll look up the nose, we'll look at the back of the throat, look for foreign bodies, pieces of grass, foxtails. This time of year, that's what we're seeing, foxtails. They can inhale them, get them in their eye, they can swallow them, get them between the toes.
Okay. So maybe check your pet a little closely when you're done hiking or you're on the camping trip. Just go over and make sure that they're not you're not carrying anything home, probably pest-wise, but also that they're not having any foreign object wedged anywhere.
Yes.
Imagine probably in between the toes, too.
Yes,
Remember with our lab, hunting dogs get all kinds of stuff shoved up in there.
And if you see some kind of discharge with them licking it, time to go to the vet.
Okay. I just want to go over real quick again the different types of coughs that we need to be aware of in our pet.
Yes, so there's a dry cough. And dry cough we can sometimes see with allergies, just an occasional cough. It's different than a goose honking cough, which is a really loud, it's like a very loud dry cough.
And that's probably more like kennel cough.
That's more like kennel cough. Or the wet cough, it's almost like they're trying to spit up phlegm or there's moisture. Sometimes that's associated with discharge from the nose. And that would be more of a concern of something like pneumonia or heart failure. So a wet cough is a little more worrisome than an occasional dry cough. If all of a sudden there's an acute goose honking cough, that's a reason to go in. Maybe your dog has kennel cough.
Okay.
If you do decide to go in, call your vet ahead of time, say, hey, I might have kennel cough. They may have you hang out in the car and we'll come get you. Or hang outside, walk outside, we'll come get you and bring you in a separate area to do the exam. You don't just want to walk in with
Yeah, and be like, oh, I think my dog's got kennel cough. They get looked at cross-eyed. Get your dog out of here, what are you doing? And the different types of sneezes.
Yeah, so, I mean, most often it's just an occasional sniffle, sneeze, no big deal. But the violent sneeze is where you need to worry. Violent sneeze followed by bloody discharge, that's the worrisome thing.
Okay.
You know, and most common causes allergies, and we can see infections, you know, foreign bodies, and less likely tumor, but sometimes we'll see tumors cause a sneeze.
So if you just feel uncomfortable, always take your four-legged furry baby in. It never hurts. Thank you so much,
Thank
Lisa.
you.
Thank you, Laz. Now you can take his nap. He's done. He's done for the day.